Yo siempre quise ser médico. Había una gama de profesiones, pero me decidí por la ciencia porque me gustaba mucho y encontré que a través de la ciencia yo podía llegar al ser humano.
I came into the world of medicine because I wanted to help people.
I actually went to the countryside working with Tibetan. Went to the hospital for training as a barefoot doctor.
Siempre me interesó el bienestar del prójimo, de que cada persona que estuviese al lado mío se sintiera bien y cualquier cosa que yo pudiera ayudarle, siempre estaba dispuesta a hacerlo.
A doctor is an instrument created by God to carry out the delicate and noble mission of alleviating people's pain and suffering, regardless of whether those people are rich or poor.
At any point in our lives, we encounter the need to visit a doctor.
Imagine that in your neighborhood there lives a doctor who saw you being born, gave you your vaccines, and knew your family's allergies and pre-existing conditions from memory, because over the years, he or she has attained all of them. Your parents, your grandparents, your brothers, and your sisters. You didn't have to tell some stranger life story every time you went to see the doctor. A family doctor is just that. A doctor who is practically a member of your family.
We have this mission that we can do so much with. In our heart, we have to understand that you're not only seeing the person as clinically as a disease or you need to take this medication. You have to see the person as a whole, spiritually, physically, socially, holistically. Because you can create more change, more positive change, when you see a little bit deeper inside of that person than just seeing the clinical part or the medical part.
In primary care, a lot of the things that primary care physicians do are extraordinarily beneficial to patients, but they're extremely difficult to measure. And if you can't measure them, it's hard to pay for them under any payment model.
We're facing a global healthcare crisis with a common cause: the lack of professional and human recognition for the primary doctor or family doctor by healthcare systems.
We're trying to expand the workforce, but there's a long tail associated with the process of creating physicians. We have to find people who are willing to go to medical school, and of course medical school is expensive, and the standards for admission are high. Those people, upon graduation, have to be persuaded that primary care is a worthy and practical specialty for them to pursue. Primary care is the lowest income level in the medical profession. And so that's difficult, especially when people are accumulating debts to go to school.
Y este concepto de doctor primario se está perdiendo en la comunidad. ¿Por qué? Porque los jóvenes no están estableciendo clínicas privadas en el vecindario.
In response to this urgency, people from all over the globe, from different walks of life and beliefs, have come together to launch a declaration for the recognition of the family doctor's role.
Salamat po, Doc!
Gracias, doctores.
Gracias, doctor.
The Thank You Doctor campaign came to life at the Vatican on November 26, 2023, initiated by SOMOS Community Care and the Pontifical Academy for Life, with the objective of humanizing healthcare for every person. Since then, this initiative is gaining vital momentum, with support from Pope Francis, and has brought together international organizations and citizens in a common call.
El sentido de la campaña que hoy presentamos es precisamente para agradecer al médico primario su papel, su existencia, su misión y su valor. Esta campaña, Gracias Doctor, como la hemos titulado, busca valorar el papel humanizador que desempeña en el sistema de salud y en la sociedad el médico primario, también conocido como médico de familia en otras latitudes. Su labor es enorme. En la mayoría de los países, los médicos de familia tienen que atender a una cantidad exagerada de pacientes, poniendo así en peligro la calidad de la relación entre médico y paciente. Por otra parte, con frecuencia, los sistemas sanitarios no reconocen de manera adecuada su contribución a la sociedad.
Soy doctor por vocación y misión y celebro enormemente que estemos aquí reunidos ante esta declaración mundial y que lo hagamos desde aquí, en el Vaticano, y con la bendición y aliento del Santo Padre, el Papa Francisco, y bajo el auspicio de la Pontificia Academy para la Vida. Esta declaración reconoce el papel que día a día desempeñan en los 5 continentes millones de médicos, que no solo constituyen la primera línea de nuestro sistema sanitario, sino que en ocasiones van mucho más allá. Ese es el médico de familia, el médico de cabecera. Es alguien que tú tienes confianza y fe, y eso se ha perdido.
È davvero indispensabile riscoprire, anche nella medicina ma non solo, che il rapporto, in questo caso, tra medico e paziente è il cuore della medicina. La medicina non può essere ridotta a un ricettario o a tecnologie anche sofisticatissime, perché l'uomo e la donna non sono mai solo la loro malattia.
Some of the most prestigious medical institutions have already offered their support to the Thank You Doctor initiative. Notably, this includes the European Union of General Practitioners, the Italian Medical Association, the World Council for Health, the Journal of Research and Applied Medicine, and the New York State Academy of Family Physicians, among others.
In my 30 years with the Academy, I've met and worked with many students, residents, and young physicians. One consistent theme that I've detected is that so many people enter medicine because they want to serve their communities as family and community doctors. The Academy works towards this goal, but we need the healthcare system to rediscover the crucial role of primary care physicians and to truly value that role.
Healthcare isn't a business. Healthcare begins with the relationship between a doctor and a patient. This is why the most important battle I have faced throughout my life has been to re-examine the practice of the family doctor. It is the antidote of the dictatorship of multinational healthcare corporations. But while we maintain a system in which we spend millions and millions of dollars, not to save lives, but to save a building and what goes on inside the building, our fight will be like that of David and Goliath.
The Thank You Doctor campaign becomes our collective voice, a powerful reminder to say thank you to those anonymous heroes who dedicate their lives to caring for us.
Well, I think Thank You Doctor raises awareness about the value and the role that physicians play in our lives. I think that can reinforce awareness of the need to make sure that we have an adequate supply of physicians, and also that we support physicians in their daily lives by demonstrating appreciation for the work that they do.
Join us in this movement of gratitude. Recognizing their worth is the first step towards a healthcare system that truly meets our deepest needs. Thank you, Doctor.
Mi sueño es poder seguir hacia adelante y de trabajar cada día que Dios me dé la fuerza para no parar el tren que sigue con la vida de la gente. Yo voy a seguir trabajando hasta que pueda. Seguiré dando lo mejor de mí para que nuestra gente esté bien.
I often have a patient come to see me. Doctor, I have a back pain for so many years. You know, after your treatment, back pain is sorry. I can sleep better. I can do my work, and they bring me a cup of tea. Oh God, it was like, that's the best. And I work on the street. and they can see people, hi, Dr. Zhang, how are you? These people have treated you, right? You treated these patients, so they remember you. And so that's the best. That makes your day.
Pope Francis has shown his respect and admiration to all the doctors of the world, blessing this campaign. By now, more than 1 million people have signed the Rediscover the Family Doctor Declaration.
Oh, Pope Francis. For me, the fact that he became part of this whole campaign gives me more motivation to go on and be a better doctor.
Gracias, Papa Francisco.
Visit thankyouDoctor.org to support this campaign with your signature. Your voice matters.